But more and more of our parents and grandparents are needing assistance in their daily lives, and many want to continue living in the comfort of their own home. That hasn't always been an option. Here with more, please welcome the president and CEO of SYNERGY HomeCare, along with Amanda Duke from the Alzheimer's Association. Hello there. We are talking about this whole baby boomer generation, and there's like a mass of people entering just an older state, and we're living longer as well. There aren't enough places out there to take everybody in, so it makes sense that we would stay in our own homes, and can be more affordable for a lot of folks.
That's right, Deborah. SYNERGY HomeCare has seen this. 80–90% of folks who are moving into retirement want to stay in their own home. It's familiar surroundings. It helps them live older and longer if they live in a place where they're comfortable with. And so SYNERGY HomeCare goes into the homes of all our clients. We help them where they feel comfortable. We have great caregivers that can help them with anything from, say, homekeeping, to meals, to helping them maybe with a shower or any personal care that they might need.
So just those little chores, there is a point where sometimes people need to have that full-on medical care, but in this case, these are those little chores that can make the difference between them hurting themselves or not getting something done, but they can stay in their own home and feel their independence. I think that's a big thing for a lot of folks as well. All right, Amanda, you're with the Alzheimer's Association. You had grandparents who went through this, and you realized what a hardship it was on your family, but SYNERGY HealthCare can help a lot with this situation.
Yeah, so Chad and I actually partner because the Alzheimer's Association is able to do training for the employees of any of these types of companies. We do a lot of education programs to help educate the employees so they know how to handle ones with Alzheimer's.
Yeah. And so with you all, a lot of your patients are people with Alzheimer's. And the problem, of course, for family members is they might not be able to watch them all day, but they don't feel comfortable leaving them alone. And there's a wide range of symptoms in Alzheimer's.
There is. Alzheimer's is a difficult disease. We have families that deal with it every day. And to be a family caregiver of a person with Alzheimer's is hard. And so we come in and help them. We have a lot of caregivers that know how to do care for Alzheimer's. Amanda's association works with us. We partner with her to train our caregivers so that we understand the symptoms. We're able to deal with it. We're able to help families get peace of mind, and also are able to allow themselves to go to that full-time job, but have someone at home so they can feel comfortable knowing their parents are getting the right care.
This is an area that's probably one of the fastest growing in our country right now, but you all are on the forefront of that. And what sets SYNERGY apart? What are some of the things that set you all apart?
What we have is a group of caregivers that are trained to do the care the right way. And part of that is partnering with Amanda's group. We have a whole set of caregivers that are not just trained, but they are background checked. And also they have that empathy and that caring that really allows them to connect with our clients and to give those families peace of mind. That's what we really try to say, is that our families have peace of mind knowing that SYNERGY is providing care for them.
Yeah. And he's right. It is so tough with Alzheimer's patients because sometimes it can be very frustrating. Yes. And sometimes you might not just really know what's going on, but you train people to have that patience. For a lot of us, we have parents who might be getting a little forgetful. It doesn't necessarily mean it's Alzheimer's, but what should we look for? Because treating it early can also delay some of the end game, if you will.
Certainly. So, basically, there are some warning signs of Alzheimer's, and there are some things that are just general aging. People are going to forget. It's just the way it is. But when they become, they forget larger things, maybe the memories from the past are forgotten, and when they start really not being able to recognize people, their loved ones or their home, they start wandering. And 50% of those with Alzheimer's disease are not diagnosed. So we certainly encourage people to get out there. If you think you might see some of the warning signs, go to the doctor. It doesn't hurt. There are a few medications on the market that can slow the progression of the brain disorder. So we just encourage people to get out.
And because there's certain things, even like forgetting that you have the stove on, we've known over and over again where people, the house could burn down. So that's where, again, where you all can come in and say, we'll prepare your meals. You don't have to deal with cooking. We'll prepare your meals and take care of those things. You have an Alzheimer's walk that's coming up.
Yes.
That's right.
Yes, so Chad is the chair of our Woodlands Walk to End Alzheimer's, but we have 13 walks in and around the Houston area. They all take place in the fall, but we're forming teams and committees currently, so you can find out more about that on our website.
Yeah.
And we're excited. Those walks are very important to what the Alzheimer's Association does. They're researching to try to find a cure.
Well, it's why we have some of those drugs right now that can help delay the effects, but one day we're looking for ultimately the cure. And it's a great atmosphere too, because sometimes people can feel very isolated and alone. You get out there and people can share what they've gone through, and you feel like a family that's fighting it together.
Exactly.
Well, for more information on Synergy Home Care, you can log on to synergyhomecare.com or call 1-844-7-WE-CARE. Those numbers break down to be 1-844-793-2273, 1-844-793-2273. And for any information on Alzheimer's disease, call the association's 24/7 helpline at 1-800-272-3900 or log on to their website at alz.org/Texas. All right, ladies, time to get